So this exercise specifically is going to help us focus on finding a neutral pelvis. We're going to be moving to pelvic tilting in order to start turning on our lower abdominals. But first, I want you to think about your position. You can come sitting to a chair, you can come onto the floor, you can even do this lying, but I just want you to get a visual. So you find your hip bones in the front. And many of us, after we've been pregnant, we naturally fall into an anterior pelvic tilt, right? We just had our babies in this position and our bodies are now trained to be here, and we've lost that lower abdominal engagement. Our ribs start to flare, and that fires up these back muscles. You can even reach back there and feel those muscles turned on. So, first, what we're going to do is find a neutral pelvis and how that feels in our body. So, you're going to take your hand on the back side of your sacrum, that little triangle bone in the back. Then you're going to place your hand on your pubic bone. And what you're going to do is you're going to drag your back hand down and your front hand up. And this just gives your body a feel. You can move it back and forth a few times, but a lot of us have lost this ability to be able to flex our spine, especially as women. If we sit a lot, whether we're nursing or if we're out of that phase, we've just sit a lot for work, or we've just learned that this is the position of our pelvis and we've never retrained our lower abdominals, then we can get a lot of compensations that can lead to tailbone pain and prolapsing and leaking and increased diastasis. So again, find that neutral position, bring the ribs down, and you're not going to crunch, right? You're just bringing them back, and then you're going to create lift with your head without flaring your thoracic spine. So we're creating space in the pelvis. So again, even if it's a few millimeters, we're drawing the pelvis back, we're bringing the ribs down, and we're creating lift. And from this position is where all of our core is going to start. Now let's take this to the floor. So you're going to lie onto the floor next to my little kitty here. And you're going to come into this position. And I love if you want to have your head supported. But what you're going to think about is, first of all, when we're thinking about an anterior pelvic tilt, a lot of us have lost our ability to contract our proximal hamstrings. So the hamstrings tug on those sit bones and allow the pelvis to come backwards in space. So that's that neutral pelvis that we're looking for. So I want you to create a drag of the heels towards your butt, right? And notice if your hip flexors turn on. And if your hip flexors turn on, I want you to find those lower abs and see if you can gently put the lower back into the floor. If you can't get your hip flexors to relax, then just let the drag go and see if you can tilt the pelvis back. And let's work with our breaths here. So you're going to find an inhale, and don't inhale into your shoulders. You're going to exhale and then inhale into belly, ribs, and back. And then you're going to exhale out of pursed lips, like you're blowing birthday candles off the ceiling or breathing out of a straw. You're going to exhale and feel these lower abdominals turn on, which naturally pull on the pubic bone to draw the pelvis back into a neutral pelvis. So again, if we have been mamas, and it really doesn't matter how long in the journey you are, if you have not worked on these lower transverse abdominals, then we can tend to fall into the anterior pelvic tilt. So again, find the exhale and draw the pelvis back and hold it for a few seconds. But I really want you to feel those lower abdominals. Inhale, let it go. Exhale, feeling the lower abdominals. If you have any bulging here in the abdominals, you don't have to pull as hard, or you can support your head with a towel. That can actually take pressure off the abdominal wall. Or what you can do is not tuck as much. So you can let out some of the tuck until we can regain some of the abdominals, or work with a professional and they can really help you. This is going to be your starting point for any of your abdominal exercises. So we'll record another video for that. But again, this is pelvic tilts, and you can do 5 to 10 of these a day. And you can do these sitting, you can do them standing, you can do them lying down, you can do them side lying. So just playing around with your ability to be able to flex your spine is going to be huge for turning on your abdominals. Again, you should feel nothing in the butt. You should feel it all in the lower abs. And if you cannot feel this, also grab a little ball if you're still having trouble, or I would grab a ball anyway and put it in between your legs. And that's going to bring in some of the adductors, which help with connecting the deep core. Awesome. Enjoy.